Hi, my name is Dr. Robert Antelak, the dentist at thegentledentist.com in Shelby Township, Michigan. Phone number is 586-247-3500. And our website is thegentledentist.com. We have tons of information on our website, so please visit it. And I'd like to speak about cosmetic dentistry. What is cosmetic dentistry? Well, cosmetic dentistry means a lot of things to a number of people. Basically, it is the way that we project ourselves and the aesthetics and the appearance of someone's smile and their lips that support that surround the teeth. It's all very important with what we're doing as far as cosmetic dentistry. So, cosmetic dentistry means that to have a pleasing smile. A pleasing smile is one where when you smile you show your top teeth and not your bottom teeth. When your lips are at rest and maybe watching television or something, you might just show maybe a millimeter or two of the teeth, which is a very small amount. When you talk, most of the time people just show their lower teeth. When you smile, you will see your top teeth. And what it is what do people want? Most of the time as we age, everything starts drifting south. So gravity starts taking its effect, and so when we were younger, maybe in our 20s, we would show maybe all of your tooth when you smiled, and maybe when your lips were at rest, you'd maybe show 4 millimeters of your teeth. As we get older, everything starts shrinking down, so now we start showing more of our bottom teeth and less of our top teeth. So what can we do about that? Well, we can have some plastic surgery done to plump out the lips, doing Botox. We can do that. We can do some facelift types of things as you get older, if that's your desire. But also, what we can do too is we can make the teeth look longer by possibly lengthening them. That's done through veneers, dental veneers, and we can give it an artificial appearance as if you have a more youthful smile like that. Also, we can do whitening. Tooth whitening is the most commonly requested procedure that we have in dentistry. Many times with our questionnaire that we ask our patients, do you want your teeth whiter? And most everybody says yes. And that is because whiter teeth look nice. It looks fresh, and it gives people a lot of confidence in what they're doing. So we can do the whitening process. We have at our office, we have core whitening, we do night white, we even do the discus. At our office we do the discus zoom whitening. So, but I would recommend using usually the core whitening if we have to get a profound change in the color, because it's really designed for people who have sensitive teeth and to get a really extreme change in the color of the teeth. So we do also fillings. You've got the silver mercury fillings that were placed. They've been in process for more than over 100 years. These contain about 50% mercury. That mercury that's in it is bound up in a compound, but there are small, minute amounts that do leak out into the environment, and so into our mouth. So what we do is we replace those with we have a special suction unit that we use that goes around the tooth, and it allows us to remove them without getting any of the mercury inside of the mouth to speak of. So you don't have to swallow it and consume it. So we change those over many times to tooth-colored composite fillings. Those are done directly in the office, and it uses a plastic material that literally bonds the tooth together. The advantage of using composites over the silver fillings is that the composites, number one, they look nicer, number two, they're bonded, so they make the tooth stronger, and number three, they don't contain mercury, so they're really not toxic. When using crowns, I like to use an all-porcelain crown, such I'm holding 2 different crowns in my hand. And what I'm going to do is I have a little light here that I'm going to show. The one on my left, on your right, is you can see the light shine right through that. All right, and that is an all-porcelain crown. That gives you natural translucency of a smile. Now, if I move over to the other one, that is a metal crown, and you cannot see light shining through that. The problem is that when when you have these porcelain to metal crowns, like the one on your left, on my right, versus the all porcelain crowns, that the color is not allowed to show through the tooth. And so when the color is not shown through the tooth, then it gives the appearance of being dark and gray. The roots actually, because the roots don't get any light within the roots itself, the roots look dark and the gum line looks dark around where a porcelain diffused to metal crown is. Compare that to either using a porcelain veneer or even all porcelain crowns like I'm showing you here, where you can see the light transmitting right through it. That gives it a much more natural appearance. When somebody smiles, it just looks right. It doesn't look fake. So if that seems to be something that bothers you, please give us a call and we can do some things and talk about that. There are many other facets to cosmetic dentistry that we have. In fact, with our patients, each new patient exam, I'll take a set of photos and I'll show our patients on our computer monitor what their mouth looks like, and we'll look at it together and we'll come up with a solution that is right for them, the one thing that is most appropriate for them. At our office at thegentledentist.com, we take pride in the fact that we don't push anything down someone's throat. We don't have an agenda. We're here to help educate and to meet the needs of those people who trust in us. So why don't you try us and give us a call. Our phone number is 586-247-3500, or visit us at thegentledentist.com. Thank you. Have a blessed day.